Hello, my dear curious and studious students of surgery. Myself, Dr. Mahesh Chaudhary. I am warm welcoming you in my surgery lecture series. This surgery lecture series contains entire surgery with anesthesia, with radiology, with orthopedic. So stay tuned with us. Let's start our surgery lecture series. Welcome, my dear students. In our surgery lecture number 122, that is the common drugs for anesthesia. In this lecture, we will explore the Gallamine, Succinyl and neostigmine. These are the common drugs for being used for the general anesthesia. Now first we start with the Gallamine. First introduction. Gallamine is a synthetic quanternary ammonium compound with curase-like action. Mechanism of action like tubocuraine, that is the combined with the cholinergic receptors on the motor and the plate and thus blocks the action of the acetylcholine by the competitive blockade. Hence, acts selectively in the region of the motor and plate. Pharmacological action of the Gallamine is the skeletal muscles highly selective action of the competitive blockade of N and M junction. Ganglia blocks the parasympathetic ganglia. Cardiovascular system weak but highly selective cardiovagolytic action which leads to tachycardia. Now the uses of this Gallamine drug is the skeletal muscles relaxation. Pharmacokinetics are the root parenteral onset is within the 1 to 3 minutes and duration of the action is the 25 to 30 minutes. Now the advantages of these drugs are does not release histamine in therapeutic doses like tubocuraine, hence no bronchospasm, salivary or tracheobronchial or gastric acid secretions. Disadvantages of Gallamine drugs are less potent skeletal muscle relaxant like tubocuraine. It blocks the parasympathetic ganglion and has cardiac vagolytic effect, so tachycardia, arrhythmias and hypertension especially with cyclopropane. Unlike tubocuraine, it can cross placenta and hence not used in the obstetric practice. Shares adverse effects of tubocuraine, that is the hypoxia and respiratory paralysis, hypotension, regurgitation of gastric juice into the esophagus, paralysis of the esophageal sphincters and diaphragm, esophageal ulceration. Preparation and dosage of the Gallamine are 40 mg per ml injection of 2 ml ampoule or 10 ml of vial is available in the market, and this is the water sodium sulfate. Dose 1 mg per kg of body weight intravenously given, followed by the smaller amounts every 30 to 45 minutes if required. Now the next drug is the Succinyl, peripherally acting skeletal muscle relaxant. Structure is quaternary ammonium. Action, it acts as an agonist of the acetylcholine and produce the skeletal muscle depolarization. It is the slowly destroyed being susceptible only to pseudocholinesterase. This causes prolonged depolarization during which muscle is the insensitive further impulses and remains paralyzed. Action on skeletal muscles. Paralysis is the preceded by the transient muscular fasciculations and twitching, usually in thoracic and abdominal muscles. It relaxes limbs and neck muscles in the dose that does not significantly affect the respiratory muscles. On the cardiovascular system, the action of this Succinyl on the cardiovascular system are produces the hypotension and bradycardia. Repeated drug administration produces the cardiac arrhythmias. Bradycardia and hypotension is followed by the hypertension and the tachycardia, which is more persistent. This is the attributed to stimulation of and sympathetic ganglia preceding their blockage by high dose of the Succinyl. Now the pharmacokinetics hydrolyzed by the plasma and the liver pseudocholinesterase cross placental barrier minimally can be used in the obstetrics cases. Therapeutic uses adjuvant to anesthesia to promote the skeletal muscles, the relaxation during abdominal surgery, orthopedic manipulation and various brief procedures like laryngoscopy, bronchoscopy and esophagoscopy. In spastic disorders like tetanus, anesthetics, status epilepticus, in electroconvulsive therapy, diazepam to protect the patient from the injury. Dosage injection as 2 ml ampoule containing 50 mg dose 0.01 to 0.5 mg per kg of body weight intravenously slowly given. These are the therapeutic uses of the Succinyl. Now the adverse reaction of the Succinyl are the cardiac arrest and the arrhythmias, high incidence. The use of the Succinyl halothane combination produces the cardiovascular system collapse. Effect of the digitalis is enhanced. Hence the ventricular arrhythmias occurs in the fully digitalized patient. Succinyl apnea and muscle soreness. These are the adverse reaction of the Succinyl. Now the next drug is commonly used in the general anesthesia, that is the neostigmine. This is the synthetic reversible anticholinesterase. Structure is the quaternary ammonium compound. Mechanism of the action, it bears the structural resemblance to A, hence capable of combining with the arsenic and the esteratic sites of the cholinesterase, but the complexes they form with the steretic site of the cholinesterase is much less readily hydrolyzed than the acetyl esteratic site complex formed with arch. This produces temporary inhibition of the enzyme. It inhibits both true and pseudo cholinesterase. Action on near about parasympathetic stimulations, gastrointestinal tract. It increases tone and mobility, propulsion of the content. On the skeletal muscle, increases the power of the muscles. In patient of the myasthenia gravis, on intra-arterial administration stimulate the chronically degenerated muscles. On the action on the cardiovascular system, decreases heart rate and BP by peripheral vasodilation. On the eye, myosis, spasm of the accommodation and reduction in the IOT, intraocular tension. Now the action of the neostigmines, secretions reduces the salivary secretions, gastric secretions in nose, mouth and pharynx and bronchi, bronchial secretion is viscid. Smooth muscles decreases tone and motility of GIT, relieves the bronchoconstrictions. Actions on the eye, mediatoric and cycloplegic drugs. On the cardiovascular system, decreases the heart rate followed by the tachycardia, abolishes bradycardia produced by the parasympathomimetic agents, cutaneous vasodilatation, that is the atropine flush, and action on the central nervous system, mild stimulant controls tremors and rigidity in the Parkinsonism. Now the dose, atropine sulfate 0.5 mg in 1 ml dose, 0.25 to 2 mg, atropine methonitrate alcoholic solution 0.6% dose, 0.2 to 0.6 mg. Pharmacokinetics route oral or IM, partially detoxified in the liver, crosses the placental barrier and is secreted in milk and saliva. The therapeutic use of the neostigmines are as pre-anesthetic medication. It reduces the respiratory secretions and prevents the laryngospasm, but insufficiency of the residual secretions from viscid plug, which is difficult to remove secondary infection. Second therapeutic use is the OPP poisoning used with oximes. Third is the CVS AV blocks as antispasmodic control hypermotility and pain also with diarrhea and dysentery. Therapeutic use on the eye, in the eye, the acute iritis, iridocyclitis and keratitis, fundoscopic examination for this drug is being used. And next for therapeutic use of the neostigmine is in the Parkinsonism. Adverse reaction of the neostigmine is the dryness of mouth, difficulty in swallowing, constipation, fever, blurring of vision, retention of urine, difficulty in urination, allergic reaction, dermatitis, conjunctivitis, swelling of eyelid, vasomotor collapse, increases pulse rate, hypotension, palpitation, paralysis of the respiratory center. These are the adverse reaction of the neostigmine. Now the next point of this lecture is the comparative properties of the important local anesthetic drugs. Potency, that is the surface injection and toxic, concentration use, surface maximum dose in injection, onset, metabolism in the plasma and liver, duration of the nerve block in minutes. First is the cocaine, surface is 1, injection 1, toxic 1, safe maximum dose not injected, the cocaine, onset is fast and metabolism in the liver. Procaine, surface is 1 by 10, injection 1, toxic 1 by 6, concentration use 1 to 2%, safe maximum dose is 700 mg, onset is slow and metabolism in plasma and the liver, duration of the nerve block is for 30 to 60 minutes. Lidocaine, surface 1, injection 2, toxic 1 by 6, concentration use 0.5 to 2% and safe maximum dose is 500 mg, onset is fast, metabolism is in the liver and duration of the nerve block is 60 to 120. Tetracaine, surface is 4, injection 10, toxic 2, concentration use 0.25 to 5.5%, safe maximum dose is 100 mg, onset is slow, plasma metabolism in the plasma and liver and duration of the nerve block is 180 to 480 minutes. Bupivacaine, surface dash, injection 10, toxic 2 and concentration use 0.25 to 5%, safe maximum dose injection is 150 mg, onset is intermediate, metabolism in the liver, duration of nerve block is 180 to 360 minutes. Dibucaine 600, surface is 6 and injection 15 and toxic 3, concentration use 0.25 to 0.5%, safe maximum dose is 50 mg, onset is slow and metabolism in the liver, duration of nerve block 180 to 600 minutes. Now doses of the anesthetic drugs is here, that is the thiopental sodium 3.5 mg per kg of body weight as a 2.5% in solution, ketamine 2 mg per kg of body weight intravenously, 6 to 10 mg per kg of body weight intramuscularly, atropine 0.015 mg per kg of body weight intramuscularly, and glycopyrrolate 0.001 milligram per kg of body weight. Pentazocine, that is the fortwin, 30 to 60 milligram intramuscular. Promethazine, Phenergan, 1 milligram per kg of body weight. Injection neostigmine 0.04 to 0.08 milligram per kg of body weight intravenously. Injection diazepam 0.15 to 0.25 milligram per kg of body weight. Injection pethidine 1 to 1.5 milligram per kg of body weight intramuscularly. Injection morphine 0.2 milligram per kg of body weight. Injection ephedrine 0.5 milligram per kg of body weight intramuscularly. Succinylmethonium chloride 1 milligram per kg of body weight intravenously. Initial loading dose. This is the initial loading dose. Dexamethasone sodium phosphate 4 to 20 milligram per day intravenously or intramuscularly. 0.5 to 5 milligram orally per day. These are the doses of the anesthetic drugs. Dear students, here is the end of our surgery lecture number 122, that is the common drugs for anesthesia. Thank you.